Hi, I'm Sarah Blaylock.
And I'm Alexis Miller.
I'm Trevor Piccone.
And I'm Gilberto Rodriguez, and today we'll be presenting our research regarding COVID-19 and its effects on anxiety and depression levels, led by Dr. Rebecca Regeth. So in March 2020, the COVID-19 disease became a global threat. The pandemic led to a global decrease in mental health due to various factors such as quarantine, isolation, and the fear of the disease. One previous study reported higher levels of stress, depression, and anxiety. Another study showed self-harm and suicide rates increased during lockdown periods.
Our study used a survey posted on social media to collect data. The study measured anxiety and depression levels. Each participant was asked to rate their anxiety and depression levels during 3 times throughout the pandemic. In 2019, retrospectively, 2020, 6 months into the pandemic, and in 2021, 1 year into the pandemic. There were 104 individuals that participated in our study. A majority were female, non-students, married, and did not have children.
Depression scale ranges were from 8 to 56, with higher scores indicating higher depression ratings. A mixed factorial ANOVA was used, and a significant interaction between time of measurement and gender in terms of depression was found, though the effect size was small. Depression scores for men increased slightly over 3 testing periods, and women's increased as well at a higher rate. A significant main effect for time on depression ratings was found, with an effect size indicating that times during COVID had a medium effect on depression levels. Depression increased significantly during times of COVID-19 compared to previous years. The main effect of gender on depression was not found to be significant. Anxiety scale ranges were from 7 to 49, with higher scores indicating higher anxiety ratings. A mixed factorial ANOVA was used, and a significant interaction between time of measurement and gender in terms of anxiety was not found. A significant main effect for time on anxiety ratings was found, the effect size indicating that times during COVID had a medium effect on anxiety levels. Anxiety was found to have increased significantly during times of COVID. The main effect of gender on anxiety was significant. Females had a higher level of anxiety than males. The effect size indicated that gender had a small to medium effect on anxiety.
Given that COVID-19 was the first pandemic of the century, there is little research discussing its specific impact on society. The findings from the current study discuss the impact COVID-19 has had on mental health specifically. From the results, we saw that depression and anxiety scores significantly increased from pre-pandemic to present, supporting previous research findings that the global pandemic worsened mental health. Depression scores for women increased at a higher rate than men from pre-pandemic to present. This could be due to several reasons, including women having a higher need for interaction with others, women internalizing their emotions at a higher rate, and women working with sensitive populations such as the elderly at a higher rate. Our results suggest the need for future research regarding the effects of the COVID-19 pandemic. Thank you to our research director, Dr. Rebecca Regeth, for leading this research, and thank you for listening.